There's a question that comes up more often than you might think. Sometimes it's whispered in the exam room, sometimes it's buried in online searches late at night, and sometimes it's just this quiet worry that sits in the back of someone's mind. It's about size, specifically what women actually want when it comes to penile length. Well, I'm Dr. Nerea Wolf, urologist and pelvic surgeon, and if you've ever had questions or concerns about your urological health, especially the sensitive ones, I want you to know you're in the right place. We're here to help you understand your body with clarity, honesty, and compassion. Today, I want to talk about this question openly, using real research, not rumors or exaggerations. And I think what you'll discover might actually bring you a lot of relief. Understanding why this question matters. Let's start here. Why does this question even exist? Why do so many men worry about this? The truth is, we live in a world that's flooded with images and messages that distort reality. Pornography, locker room talk, social media boasts, they all create this idea that bigger is always better, that to be desirable, to be masculine, you need to measure up to some extreme standard. But here's what I see in my practice every single day. Men who are completely normal, completely healthy, who carry around this deep anxiety that they're somehow not enough. And that anxiety, it doesn't just stay in your head. It affects confidence, intimacy, relationships, even mental health. So today, I want to give you something more solid than anxiety. I want to give you science, the challenge of asking directly. Now, if you want to know what women actually prefer, you might think the simplest thing to do is just ask them, right? But here's the problem with that approach. When people are asked questions about sex in a public or semi-public way, like in surveys or interviews, their answers can be influenced by all kinds of things. Social expectations. What they think they're supposed to say, what sounds acceptable, even what they think the researcher wants to hear. So researchers needed a smarter approach. They needed to look at behavior, not just words. They needed to see what women actually choose when no one is watching, when there's no pressure to perform or impress. And that's exactly what they did. What the purchase data reveals. A research team decided to analyze something very practical, what women actually buy. They looked at 8 major online retailers that sell intimate products, specifically penetrative devices designed for vaginal use. They analyzed the best-selling products, not the ones marketed as the biggest or the most extreme, but the ones that women actually purchased most frequently. And here's what they found. The most popular products had an insertable length between about 4 and 6 inches. That's roughly 10 to 15 centimeters, and I want you to hear that again, 4 to 6 inches. In fact, across 6 of the 8 retailers, the average length of the best-selling products was less than 6 inches. Now, why is that number so interesting? Because it lines up almost perfectly with the average size of an erect penis in adult men. If you want the exact numbers, and I've covered this in detail in another video, most men fall somewhere between 5 and 6 inches in length when erect, with a circumference of about 4.5 to 5 inches. And that is completely, entirely medically normal. What about girth? Length isn't the only factor, of course. The same study looked at circumference, what we often call girth, and the average across bestsellers was around 4.5 inches. Again, that's right in the average range for men. So what does that tell us? It tells us that when women are choosing for themselves, without outside influence, they're not seeking extremes. They're choosing what feels comfortable, pleasurable, and realistic. Another study confirms the pattern. A second research team took a slightly different approach. They analyzed the top-selling realistic penetrative products from 5 major US retailers, plus Amazon. The average insertable length? About 6.5 inches, slightly above average, but not dramatically so. This suggests that while some women may be curious about something a little longer than average, the preference still stays within a very reasonable range. There's no widespread demand for extreme size. What influences purchase decisions? Now here's where it gets even more interesting. The researchers didn't just look at size, they also analyzed what factors influenced whether a product sold well. And guess what mattered most? Price and girth. Length, it was less important. In other words, many women prioritized affordability and a comfortable fit over maximum. length. In fact, products with above average girth were actually less popular than those with average girth. Let that sink in for a moment. What this all means. So what does all of this research tell us? It tells us that when women have complete freedom to choose, when they're shopping privately, without judgment, without pressure, the majority select products that are average in length or just slightly above average and average in girth. They're not looking for extremes. They're looking for comfort, pleasure, something that fits their body. This is completely different from what you might hear in popular culture, in jokes, or in exaggerated stories. But this is real data. This is what actually happens when you remove the noise and look at behavior. So if you're within the average range, and most men are, you are enough. You are normal. And you are more than capable of satisfying a partner. The role of individual variation. Now, I want to be clear about something. Every person is different. There will always be individual preferences. Some women may prefer slightly more length, some may prefer less. Some care more about girth, some care more about technique and connection. There was one study I've discussed before that found women who frequently experience vaginal orgasms tended to prefer slightly longer lengths. But even in that study, slightly is the key word. We're not talking about extreme differences. And here's the most important thing. Sexual satisfaction is not determined by measurements alone. It's determined by confidence, communication, emotional intimacy, trust, and presence. A person who is attentive, who listens, who cares about their partner's experience, that person will always be a better lover than someone who focuses solely on size. The trap of comparison. One of the biggest sources of anxiety I see in my practice is comparison. Men comparing themselves to what they see in pornography, or to locker room talk, or to exaggerated stories online. But those comparisons are almost always unfair. Pornography is a performance, not reality. Locker room talk is often exaggeration. And online stories? Well, people don't usually go online to say, everything was perfectly average and wonderful. So when you compare yourself to those distorted images, you're setting yourself up for unnecessary pain. The truth, the real medical, research-backed truth, is that average is exactly what most people prefer. Average is desirable. Average is normal. When worry becomes a problem. Now, I do want to address something serious. For some men, worry about size goes beyond occasional concern. It becomes a constant preoccupation. It affects daily life, relationships, and mental health. In extreme cases, this is called small penis anxiety or penile dysmorphic disorder. It's a real condition, and it can be deeply distressing. If you find yourself spending more than an hour a day thinking about this, if it's affecting your ability to be intimate, if it's causing depression or shame, please talk to someone, a urologist, a therapist, a counselor. There is help available, and you don't have to carry that burden alone. Because here's the thing. Most men who struggle with this anxiety have completely normal anatomy. The problem isn't their body. It's the distorted lens through which they're viewing it. The real foundation of intimacy. Let me tell you what I've learned from years of talking to patients, both men and women, about sexual health. The most satisfying intimate relationships are built on trust, communication, playfulness, and emotional safety. They're built on two people who care about each other's pleasure and who are willing to learn together. Size is such a small part of that equation, and yet, because of societal pressure, it takes up so much mental space for so many men. If you can let go of that worry, if you can trust the data, trust your body, and focus on connection, you'll find that intimacy becomes so much richer. A word on communication. One of the best things you can do for your sexual health is to talk openly with your partner. Ask what feels good. Share what feels good for you. Be curious. Be playful. Most partners are far more interested in how you make them feel emotionally and physically than in any specific measurement. And if you're with someone who makes you feel inadequate or ashamed about your body, that's a relationship issue, not a body issue. So here's what I want you to take away from today. The science is clear. When women choose freely, most prefer what is average or close to average. The extreme sizes you see in media are not what most people want in real life. If you're within the normal range, and again, most men are, you are enough. You are desirable. You are capable of giving and receiving pleasure. Your worth as a partner, as a man, as a person, is not measured in inches. It's measured in kindness, confidence, presence, and care. If you found this helpful, I hope you'll share it with someone who might need to hear it. And please, take care of yourself. You're worth it, exactly as you are. Stay connected with us for more guidance on urological health. We're here to help you understand your body with clarity and compassion.